All right, everybody, we have our first advanced spinal healthcare class. These are something that we used to routinely hold in the office, and this is something I've wanted to bring back for a long time. We're going to have some great classes and education coming up, not just from myself, Dr. Fowler, but from also Dr. Espinosa, Dr. Davison, and Dr. Phillips here in the office. We're going to be sharing the wealth and all the great health tips and information. If you haven't been in our office recently, since last February, we decided actually to take over the t-shirt shop next door, and we're so excited. We have rebuilt both sides. It's like the mega office now. So I look at it, my wife actually helped us decorate it. It's so pretty, it's awesome. But we have many, many more tables, space, private exam rooms, decompression, the IST roller tables. Enough about me, but it's beautiful. We'd love to show it to you. On Saturday, September 29th, we're doing a big Patient Appreciation Day, so you'll get stuff in the mail and see stuff on Facebook for that. Any other announcements? We do have our dinner talks still. If you haven't been to those or have friends and family that want to hear more about chiropractic, please check out any links for our Dinner with the Doc program. And tonight we're going to talk about one of the most important things that we can talk about is, yes, your health, and how chiropractic itself blends in with the health and allows you to stay at your optimal function. And this is huge because as we're talking about it, the why, we always want to get to the whys with any of our patients, not just you have neck pain or you're not a number or back pain, but really the why is like your family and the things that you want to do. What's your mission in your life? Because people now are living longer and longer and longer, but sadly the length of our lives or the quality of our lives are getting less and less. And it's because we used to move, we used to hunt, we used to farm, we used to gather and all these things, and now we sit behind the desk. And we've got these crazy, just sitting jobs in school for years, and it's having a problem with our spines. Just like the dentists, they've done a beautiful job with educating with cavities, with getting your teeth checked. If you never went to the dentist, how many cavities would you have? Well, chiropractic's problem, sorry, that we didn't get you when you were kids, like all the kids that are in our office, but our problem is that we're not getting to adults until they're falling apart. And the clinic, again, is called First Step Chiropractic. Most of the time we're not seeing people till like we're their 7th doctor, their 8th doctor. So this is vital information. If you want to share the stuff we have tonight, please share it, please like it. And I'm going to be doing these talks at least once a month and just adding on to the great exercises and things that we're going to talk about. So we're going to talk about why is health important with your spine. We're talking about exercises and how to change your environment so your spine can be healthier and you can live a longer and healthier life. So the problems here, we've got some sports injuries. We've got, the falls. Oh, that's a rough looking picture there. That looks like one of my kiddos. And so she, you fall, I think 30,000 times just learning to walk. And so from there we also have, car accidents, these things happen. And then this is actually the worst one. So look at this posture. We should be up like this. We're going to talk a lot about that in a moment. But you see how she's coming forward here? It's not really the trauma, it's the micro trauma. And so the biggest thing to think of this, in the 80s and 90s, carpal tunnel became huge. Most of us know people have carpal tunnel surgeries and things like that. It wasn't a traumatic accident that causes carpal tunnel. It's the years of doing this or the mouse stuff. Well, now what we're seeing is the same thing from people using the cell phones all the time, from the iPads, from the laptops, that we're seeing those same carpal tunnel type issues, long-term repetitive major issues in the spine. So before we get into that, we're going to first talk about just the big concept. In chiropractic itself, we believe in something called innate intelligence. And this is something that is in the body from literally 2 cells. It goes to 90 trillion cells over that 9 months. There's an innate intelligence that wants you to be healthy, that wants you to just thrive. And it's that same innate intelligence that if you cut yourself is going to heal. It's that thing that's the difference between a steak and a person. If you cut a steak, it doesn't heal itself. That'd be kind of creepy, right? So from there, it starts to clot, the scab goes on, and then it's like it never happened. Well, that's how our body is. Even the most advanced procedures that we have, the most biggest surgeries, they cut you open, they sew you up, and then at that point, the body goes and does its job, and it heals those scars, it heals those sutures. So we have this amazing innate intelligence inside our body. Now, B.J. Palmer was the developer of chiropractic. B.D. Palmer made it. B.J. Palmer created it. And so he has many, many quotes that we're actually getting designed and putting around their office right now, but that he's famous for, these epitaphs. And one of the biggest one is nature needs no help, just no interference. And what that means is your body knows how to heal. It knows how to function. It knows how to work at its highest level, but when we're, eating chemicals and, those bad foods, and we're sitting all day and we're all stressed out like crazy and we don't get away from things, or when we're not exercising and having motion, or when we're taking too many medications. And there are medications that save our life, but we're taking too many medications, there's still toxins. All of these things come in and it creates interference in the system. One of the biggest interference also, the nervous system in the body. We have a spine that holds us up. It's supposed to be straight up and down like this, even hips. And then from the side, we have these distinct curves in the lumbar spine, thoracic, and the neck. And so what that does, it creates a shock absorber. All of the big bones here are made to hold up all the weight. If you shift it a different way, it wears out faster. Just like a car with bad alignment, the tires are going to wear out. And so not only does it hold us up, but it protects the nervous system here. And so we have the brain, which obviously controls everything. The nose nerves go out, just like the information superhighway, like the network cables in a, I don't know why I'm saying this funny, but the network cables in a building or in this office. And so they go out from there to every organ, every cell, every tissue, and they help coordinate that function. And the better that they're communicating, you have a balance, or what's called homeostasis. If something's off balance, then it goes faster than it should. If it's going the other way, it goes slower than it should. And this is what we call the sympathetic and the parasympathetic nervous system, not to get too fancy. But what is happening here is the body is trying to always be in balance with its environment. But if you're putting in all this junk and if you're putting in all these things, the body gets overwhelmed. Almost just like if you were swimming with a backpack on. We just did our backpack safety video. Check that one out on Facebook. But if you're swimming with rocks in your backpack, you're going to start to go lower. Now, if someone puts more in, it's going to be harder to stay above water. That's just like us with the pressure and what's going on with our nervous system. If there's so many things going wrong, finally one day it just gives out. Well, if someone starts taking those rocks out, you can function better, you can swim better. Same thing here, as we adjust the spine over time, it gets motion back within these joints. It allows the body to become closer to homeostasis and allows the body to balance and start to heal and communicate like it should. So it allows that innate intelligence inside us to start to work better. And that's the big picture, number one, is because that's when people start breathing better. They start getting sick less. I had a patient, she said, I know I need to get adjusted because I've missed a few months, school's been stressful, summer was stressful, and I started to get sick again. And that's why she came in today, not because something hurt, because she knew her body was not working as good as it should. And so that's how important it is. Now, movement. Movement is the most important thing for our spine. Now, as that goes, movement itself fires through the body. There's more sensors in the upper cervical spine than anywhere else in the entire body for movement. Fires into the cerebellum and into the front of the brain that actually helps us feel better, move better. It releases just good chemicals in the brain, good neurotransmitters that allow us to function at a higher level and feel like ourselves, feel good. They say that exercising can give you the same results over time than taking even depression medication. Nothing against those or what people in those cases, but that is scientific literature saying that the movement makes that much of a difference with our bodies. And so motion is essential for the body to function the right way, for moving around, for the heart to function, for the lungs to have optimal function is that movement. So if you're sitting for 8 hours like this, your body starts to get locked up. And most patients, as they come into the exam, say 80%, I have them take a deep breath, and they go, their lungs don't move at all, or barely. So say, Mike, breathing at 40% here makes a huge difference. Now, once we get you adjusted, you're gonna start breathing at 70, 80, 90%. And then, what does that have to do with energy? What does that have to do with your sleep? It's gonna all improve. So movement is most important. One, when you come in, we're gonna help you feel better and get out of pain. And then from there is getting function back in your body so you can actually start to move and work the right way. Now, as the body is not moving over time, it's not going to waste this energy. It's super smart, amazingly designed. And so it's going to start to tighten up muscles in areas that are not working. So if you have a segment like this, these vertebrae, that say are not moving from being stuck at a desk all day or from a car accident or a sports injury, and they're not working right, all of the muscles around them are going to start to spasm. And they're going to do this slowly, but it's just like, you don't feel like you can turn and move as good as you should in the past. And then if it does that long enough, it's going to lay down scar tissue to make it more permanent, because it doesn't want to waste all that energy to keep it moving. Then the disc, which is made of like a big sponge, is going to start to decay. It's going to start to just wear out like an old dried sponge on your sink. And then from there, the nerves actually grow more to protect that area. Because it knows now it's not as healthy, movement's not going to be as good. And it actually sets things in place to make that permanent. Also called degeneration, where the bone starts to grow together. And there's different phases of this, but 2 or 3 meaning that they are literally growing together, and we see this in many of the x-rays. For those people, we caught it right in the nick of time, and we have to get motion back in those segments over time with the adjustments, with the exercises, with the home exercises, and so those areas can actually start to function the right way. So this, if you know anyone that has these major disc issues, we do offer decompression therapy now. We've got 2 separate tables to work with the neck and the lumbar spine to pull on those different areas and to actually get quicker results for any of our disc issues or patients with disc issues. Now, structure-wise, our spine, as I mentioned, from the front should be straight up and down. That is the strongest way that it's able to work. From the side, it should have these distinct curves. The curves themselves, so these are the, this is a technique called chiropractic biophysics that they found that the spine is supposed to have these distinct curves in it. Now, when I went to Spain when I was in high school, I got to see these Roman aqueducts in person, and they're amazing because they're about 5 stories tall, made with these stones, and they've stood up for centuries. But the cool thing is that I noticed is that on the top of each one is a curvature. And this would take water from the mountains down to the major cities, all through Italy, Greece, and Spain. And so in these areas, those curvatures, that keystone is the most strongest curvature, or it's the most strongest shape, sorry. And so as that goes, this area, just like the curve in the spine, allows it to be strong. If these were made straight, that would have failed through the years. Same thing with the Hoover Dam. They make it a curve like this to hold back all that water, to push back and to keep the strength. So the spine is actually 24 times stronger with the curves than without. And so when we're sitting here, we want to be straight up and down, and we want to keep those curves in the spine. When we go from 3 curves to 1 curve going forward, there's an exponential decrease in the strength of our spine. It also puts all the pressure on the back joints and the nerves, putting more nerve pressure and disc pressure compared to having things aligned and giving the most space inside your spinal canal. So here we want to see with the normal thing that there's a curvature in your low back. So sitting tips, you want to have a curvature in your low back. You also, it's like if you took a thread right here from the chest, you pull up this little bit, and so you'll feel the back muscles right here tighten up. And what that does is it's that last tip for posture that you're able to work all day. Some people are able to do this. Most go, that is not how I'm sitting all day. So what you'll do then is get, we have a support called a back vitalizer that you can put behind your back. That is an air cushion that's very, very comfortable. Or just bring an extra pillow or a sweatshirt to remind yourself to come back this way. If you or one of your loved ones always sit in a recliner, put a pillow behind them. If they're in this C shape, that is going to compromise their spine over time. Same thing in the car. Most of our cars have some lumbar support, but not enough. Bring an extra sweatshirt or t-shirt for a long car ride. Put it behind you. It'll make a huge difference. Also, if you noticed, all the cars now have headrests that push forward. That decreases, if you know, decreases your whiplash in an accident, but also pulls the curvature out of your neck. So having more support here and keeping your head against that rest can make a big difference for you. But incorrect positions, again, is this leaning forward and getting into the work. Now, the one thing that they didn't show here was this should be about 8 inches higher. And so if you're at Starbucks working on a laptop or things like that, grab a 3-ring binder and put it up so it'll actually increase this about 3 inches. In a perfect world, your eyes should be in the upper 2/3 of your screen. So if you have your work environment set up, that's how it should be. At home, a really easy thing, if you go on Amazon, they have very affordable, $20, $15 laptop razors. And then Anchor is a keyboard that is only $20, which is fantastic to get. They're like the little Mac keyboards. And then also the wireless mouse, about $8. So you can create, for under $50, a whole setup that lifts this whole thing up. Or you can get a whole extra monitor and create 2 screens if you want. But those type of environments make a big difference. If you come to my dinner talk, you've heard these tips. But if you are on your couch and using your laptop or reading, your kids are reading, doing those things, or at your bed, from that point, use pillows and raise them up. From there, if your kid's doing a lot of video games this way, make them play the first 15-10 minutes on their stomachs. That brings the curvature into the neck. So sleeping positions, we all got to sleep, so let's talk about it. On your back, Should be a nice curvature underneath the head with a dip here. Her hair is covering it up, but a dip through this area, and a curvature or a pillow underneath the legs. If you're on your sides, nice pillow between the knees here. There's some, this one's showing as a cutout in between. Even if you sleep, if you're all turned, your back is going to tighten up through the night. You want your spine and your hips to be straight up and down and move in the right way. So you'll have a curve or a pillow in between your knees. I don't know if you can see this, but if you sleep all up like this or half on your stomach, put a pillow still under your knees. And then if you turn this way a lot, put a pillow in front of you, or a person, but that you can hug like this, all right? So not like that joke, cool. And so from the side, you should have a nice thick pillow. We have the Perfect Pillow here in the office, so if you want to check that. Also an amazing pillow for guys more because they're a little more firm, but they can come even this thick, is called the Tempur-Pedic, or not Tempur-Pedic, but Therapeutica. I've used those for about 10 years. They're a beautiful pillow. So on here, every inch, when you're doing the phone, when you're doing laptop, those things, your head is forward, is 30 pounds. So here, 15 degrees forward, 27 pounds of pressure in all these areas, tearing apart your spine over time and causing symptoms, decreasing your lung capacity, not good. And so all of these things we want to bring up, as we mentioned before. Check your family. Have them stand here. You can do it against the wall if you want, or just have them stand up, and the shoulders should not be forward. They should be to the center, and then the middle of the ear should go over the shoulder, over the hips, over here. Most of us you're going to find like this. If that's the case, then we need to start doing some wall exercises. We can give you a handout for that at the office. When we're going through care, what we want to see is an increase in curvature on the x-ray. Now, of course, if your hips are unlevel or those things, we're not going to go through every one of those examples tonight. We want to see changes in those. But for life, for vitality, most of the nerves going to vital centers, we want to see a change in the curvature. If there's changes here, we know there's changes in the whole posture. So we have someone that's straight. After we're able to take new x-rays, see changes in the curvature. We have these x-rays normally all marked up with all the degrees and those things for you. But this is what I want you to think of all the time. If your neck is back this way, and 90% of the time you're going to have a beautiful curvature there, all right? And so we want to have that curvature back and then start to support and do things that bring this back in. So that's going to be the biplate exercises where we're bringing the posture back. The biplates have been shown to increase exercise 3 times. From that point, we have the cervical traction that you do before your adjustments. The adjustments are the most important thing to get motion back within the joints that are not moving properly. And we have your home exercises from using the towel, using the neck orthotic, and then also other ancillary things like a posture pump or things like that. So first of all, in the clinic, all your warm-ups are designed to get motion back in your spine. And even though it might be funny to go through these little motions and things like this, I bet you if we videoed you all of the day, you probably haven't done all those things. From there, get adjusted. Getting adjusted is the quickest and best way to get that motion back in your spine. And then the home exercises from the posture band that pulls the shoulders back to the neck orthotic and the towel. So let's talk about those. First, when all of our patients start, we ask them to roll up a towel, very similar to this. Put it behind your neck, or if you can take it, pull it under your shoulders a little bit more. And what that starts to do is bring that curvature in and getting you used to actually coming back. We want the chest and the clavicle and the ribs to open up. We want the neck to start to come back this way. Doing that for 10 to 15 minutes every night before you go to bed. A lot of people like to stretch in the morning and say, oh doc, I was hurt and I stretched, I felt better. Once you get in the mindset of doing these things before bedtime, the morning stuff is just a bonus. If you do it then, awesome. Love that you're doing them twice a day. But the stuff that you do at night erases the stress of the day and it's gonna have more correction for you. You're also gonna wake up way more fresh. If you also have a very hunched posture this way, or do things that are forward a lot, put a towel down your back so it makes a T and lay on that. You can go from arms here to here and here and stretch out the lower, middle, and upper parts of the back. And again, we have all these on your new patient handouts. So I hope you learned something tonight. We're gonna add to this. Please share it, or if you have a patient, please go into the messages or let us know what questions you had, what you'd like to know more about. This is just the first one of probably hundreds of them over the next few years. And so we will be putting these on Facebook Live so you can access them or show any other family members. But from there, thank you for being a part of our clinic. We just so appreciate it. It's our, we talk about our meetings every day. We go through our wins. every week. We go through our wins and our patients that are getting better and just the success stories, and it just makes it fun to get up in the morning. I told a patient today, I've been doing this for 13 years, and it's just amazing to be a part of it, to be able to see people progress and change. And just thank you for the trust for yourself, for your family, and let us know what other talks you guys would be interested in. And Matt, anything else over there? All right, we're rocking and rolling. Appreciate you guys.